Hey, friends, welcome to another episode of Not Your Mama's Podcast. The title of this episode is Fertility 101. In this episode, we are speaking with Dr. Jane, who is a naturopathic doctor that specializes in fertility. Her mission is to empower high achieving women through their fertility, pregnancy, and postpartum journeys. In her 6+ years of industry experience, Dr. Jane has helped hundreds of couples optimize their health and prepare their bodies for pregnancy, which allowed them to get pregnant naturally, have complication-free pregnancies, and give birth to healthy babies. Dr. Jane, it is such an honor to have you on. Thank you so much for coming on the podcast today. I think this topic is super important because so many women and men struggle with fertility. I think it's ever growing in today's society,
Yes.
and it can be very heart-wrenching for someone to experience. They're excited, they get married, and next step is to have a family, and it's just not happening. What can you say to those women out there to give them hope, to let them know that the journey for them isn't over? And how do you go by helping women?
For sure. Thank you so much for having me as well. I think it is a super important topic. That's why I'm super passionate about it, and something I don't want to say that I fell into, but I feel like it's a community that's really underserved, and couples are kind of taking advantage through this journey that is really gut-wrenching and emotional and very difficult, and there's a lot of unknowns. And then they're isolated, they don't know where to go, and then the only thing that they know to do is to go to their doctor and basically then get prescribed a medical procedure, which is invasive. It doesn't guarantee results, and then you're embarrassed. There's a lot of emotions. So my kind of goal and the way that I work with couples and women really is to help them feel more confident and in control of their fertility journey.
Mhm.
And the way that I do that is by helping them feel more confident in their body and in control of their health. And what I mean by that is, do you know what your menstrual cycle is telling you every month? Do you know how your body's talking to you and what symptoms do you have? And the biggest realization that or mindset shift that I would love to provide for people is to say, hey, pregnancy is a natural process. So when it's not happening, it's not that something is wrong with you. So don't blame yourself,
Mhm.
but something is wrong. Something is wrong. So you do need help. And we want to assess what that is, because there is a message that's not commuting. So whether it's you're not ovulating, or that ovulation isn't robust enough, so the egg is not mature enough, whether it's the quality of the sperm or it's the environment in the womb, in the uterus where the baby needs to grow, so the implantation isn't happening, there's not enough nutrients, there is something that's missing. And if we can stop putting our own worth on fertility, which I know is like basically an impossible thing to do
Yeah,
for
it's hard.
women. Yeah, but let's stop blaming ourselves and let's look at it as a symptom. Like, it's a symptom, just like when you have a headache, it's a symptom of something else going on. Are you dehydrated? Did you blood sugar, spike? Have you been sitting in computer all day? Like, is it a tension headache? You would do that for a headache, but you would never, we don't think about it, fertility, that way.
Mhm.
And the truth is, it's like, that's how I want you to think about it. And there is things that we can test and look into to help you understand what your fertility journey is going to look like. Are you going to struggle to get pregnant? If you've been on birth control for over a decade, or you've never had a regular period, or you've struggled to lose weight, or you have adult acne, those are some signs and symptoms that you might struggle with fertility, because those are the things that are telling us that your hormones are out of whack, your metabolism isn't working the way that it should, your detoxification pathways are not working as it should. And so those things are going to impact your hormones,
Mhm.
and hormones drive fertility. So if you've been struggling for a really long time, one of the messages, and I just had this post on social media, is like, invest into figuring out why you can't get pregnant or why you can't stay pregnant, instead of investing into a procedure. And if you go to a doctor and all they do is push a procedure on you, have the courage to say no, like, there's something off here. Because
Yeah.
every woman that I have spoken to is like, they knew that something was off, but there was no solution provided. And it was just like, well, it's just the way that you are. And after years of hearing that, it's hard not to believe that, because it's just like, I guess it's true.
Mm-hmm.
But I know deep down you don't feel that way. And so, have the courage to keep fighting, have the courage to find practitioners like myself. And that's partly why I'm on podcasts, to get people thinking about fertility in a different way and asking for help much sooner than what is recommended by the conventional medical system, and asking for different kind of help, right? It's not, oh, I can't get pregnant, let's do IVF. I can't get pregnant. Why? Because
Yeah.
it's a health issue. There's something going on. And so we need to look at that. And there's tons of ways that we can do that now.
Yeah, no, I totally agree. I feel like if you were to just go to like a regular doctor, they don't think about holistic approaches, and they don't look at like what's the underlying like
Yes.
hormonal imbalance or the nutrition imbalance that's happening. They go straight to, IVF, we're going to get you on this, kind of doom and gloom type of situation, which is pretty hard on the body. I've never
For sure.
experienced that myself, but I know a lot of women that have.
It's
And
very
then
hard on the
their
body.
body, they start getting stressed out about not getting pregnant. And that doesn't help for you to get pregnant when you're stressing out about not getting pregnant. So it's
Yep.
just kind of like a yin and a yang.
Snowball effect. Yeah. And you're just wrapped up in it. And I mean, truthfully, the medical care system is just not trained for it. I always say we have a disease care based model. We don't have
Yeah.
a healthcare based model. So your
Mhm.
doctor is trained to find a diagnosis. What disease do you have? Okay, great. Here's a medication that you would take for it. So outside of that, they don't have training in nutrition or lifestyle or supplementation or detoxification. It's like they're just not trained in those things. And so I think fertility is overall, like this again, a message that I say, it's like, it's your overall health is going to relate to what's going on for your fertility. So if you're not getting pregnant, we have to look at what is preventing that. And generally, when people are healthy, vibrant, energetic, they don't have issues getting pregnant or staying pregnant. The problem is there's a lot less of us who have a lot of energy and vibrance and, um, glowing with too much nutrition and too much sleep. And so then, the procedure that's offered, unfortunately, is that's all they have.
Yeah.
But that's not all that there is, is what I'm saying.
No, exactly. That's why it's so important to have you on, because if there's a listener struggling with this stuff, they can have other options out there. You don't have to go to a
Yes.
doctor to tell you something that is probably wrong. They're not always right.
Yeah.
And, kind of going back to like we have a disease care and not health care. When the Rockefellers like took over the healthcare system, they deemed natural stuff like basically not witchcraft, but like hunky
Yeah,
dory
it doesn't
doesn't
work.
work because they focused on oil-based medicine. And so that's why our doctors don't focus on any of that stuff, because they were told not to, because the money told them not to. So,
Yes, yeah.
so it's,
You are right on the money, right? You always have to follow the money. And when you look at the IVF industry and how it's and right now it's skyrocketing, right? How many people need IVF just coming from lunch? And it's like more and more people will just say it's casual, like, oh yeah, I've had 2 IVF cycles already, and they're 28. And it's like, what are you talking
I
about?
know like what
You're
exactly.
28 years old. Like, how is that? And this is before I got, because I don't want to say like I didn't want to be in the fertility space, but it was like, I thought the people that needed IVF or were struggling with fertility were wildly screwed up, for the lack of a better word. Like they had hormone imbalances and they had such deep issues that were beyond natural medicine fixing. And as I, had kind of patients and then had family members and had my own experience, I realized that this community is really underserved and undereducated. And because it's so emotional, that you will do anything to have a baby because you want to have a baby. And it's such a big drive. I get it. But shame on the medical community for using that emotion to sell. And I don't blame like the doctors. I always blame the system. You always have to look up and follow the money. But I realized that the community is just underserved. It was like, oh, your thyroid is out of whack. We know how to fix that. Oh, this is out of whack. We know how to fix that. Like low progesterone. Okay, why do you have low progesterone? Oh, because you're not sleeping well. You're not doing that. And it seems so simple, but when you put all these pieces together, my couples and women that I work with, they start to glow. They start to
Yeah.
feel better. They start to see what their cycle actually is telling them instead of suppressing it for decades at a time, not knowing how their body is functioning. And then all of a sudden, well, of course you can't get pregnant. You don't even know what your cycle is like, and you've been suppressing it I've had somebody for 22 years have been on birth control. And it's like, of course it's going to be difficult to get pregnant after that.
Yeah.
And they're not educated on it because it's like, oh, you're having a hard time getting pregnant. Here's this procedure, right?
Yeah. I know for my second, when I was trying for my second, I was having a hard time getting pregnant. Mind you, my husband was going in the sauna for like 45 minutes, like at a time almost every day. I was like, stop going in the sauna.
You're
But I
heating them up.
yeah, I'm like, you gotta, yeah, stop going in the sauna. You're killing him. Which he did, but it took like 2 months after that. But I also did like this detox diet thing, and I felt like that really helped me too. Not only was there his factors going on with like the
Yes.
sauna, also with myself as well. So, and
It
it took a
takes two.
while.
It takes two to tango.
Yeah, and I was getting really discouraged,
Mhm.
And then I saw people getting pregnant with like their second kid, and I'm like, oh my God, it's just not working. I mean, it took like 8 months,
Yeah.
for the second one, but then once my husband actually gave up the sauna, and then I went on like this, cleanse, I got pregnant right away.
Yeah.
And I was able to hold on to the baby. What does like your body tell you, like if you're having like a miscarriage or something like that? What's like a something going on? Like you can get pregnant, but you
Sure.
can't keep the baby.
Yeah. It really depends on when you're having the miscarriage. So if the miscarriage is really early on, that 5 week, 6 week mark, anything under, I would say 8 weeks, like no heartbeat was ever detected, usually it's a DNA fragmentation issue. So there's a replication issue. It's just not a viable pregnancy. And the DNA comes from the sperm or the egg, and it comes down to the quality of that sperm and the egg. And we have a lot of mitochondria, which is kind of the powerhouse of the cell in the sperm and the egg, and they carry the DNA. So if there's issues with that, you're going to have, there's so much replication that goes on in the first little bit, right? In the first 7, 8 weeks, I mean, for the whole time, but the crucial replication that most of the times, if you think about it, women don't even know they're pregnant until most of that already happens, which
Yeah.
is why preconception care is really important, because a lot of the times you have no idea that you're pregnant while there's so much important genetic code setting that goes on
Yeah, you're
in
like
that first few
drinking
weeks.
tequila shots with your
Yes.
girlfriends.
Yes, that's it. That's it. And so if you're having a miscarriage really early on, typically it's a DNA fragmentation, something, replication didn't happen the way that it should. The implantation starts to happen around week 6. And so and the hormones peak around week 9.
Okay.
And like the HCG and the progesterone should stay high the whole time. And so if the miscarriage is starting to happen again, closer to that 9, 8 week mark, because again, sometimes the miscarriage happens at week 6, but you don't actually miscarry for another couple of weeks, right? So it's important to kind of find that out and figure out when did the growth stop versus when did you miscarry, because sometimes it can take a body a couple weeks to release to release the fertilized egg. And so if it's happening a little bit later, typically it's an implantation or an implantation issue. So like whether it's the uterus is not thick enough, or it's too thick, there's not enough blood flow, or there's an autoimmune response, right? There's an immune reaction that goes on. And then of course the hormones. So the hormones don't uptake, they don't keep up. And one of the things that I'll tell women after a miscarriage is the mistake that people make is they don't do any investigation, because they're kind of just told that it's normal and keep trying until you have 3 more. And one of the first questions I'll ask my patients who have had a miscarriage is like, hey, do you know why you had it? And most women are like, no idea, no, because it's so emotional. They didn't
Yeah.
even worry, like they didn't even think about it. The right away you go kind of into the grieving. But it's really important to understand that, because each miscarriage tells you something.
Yeah.
And and then there's some testing that you can do to see why. So then you can step into the next pregnancy feeling more confident and more in control as much as you can. Because there's a lot of things that you can control beforehand. Once you've released the egg and the sperm, there's very little control that you do have. Like that's just, the
It's in
biology
God's
needs to
hands
take
now.
over. Exactly. It's in God's hands. You have to there's a lot of trust and letting go, but you can make sure that the platform that you're setting up for this future babe is at the best possible place. And that just improves your chances, right? There's just probability. Oh, now your probability is 90% instead of 40%. And
Yeah.
it's like, well, that's pretty good, right?
So kind of going back to the uterus lining, talking about too thick or too thin, like let's say someone's having those problems, like can you help someone fix that? Like, or
Sure.
is it just how you're built? Like how can you
Yeah.
fix that stuff?
So there is a variation within the norm, right? So like what's a normal menstrual cycle? You're going to bleed anywhere between 3 to 5 days. You're going to lose anywhere between 30 to 60 milliliters of blood. And that's the norm. So some women might lose closer to 60. Some women might lose closer to 30. And if you're outside of that, that's when we start to raise questions and be a little bit more, the curious George of like, what's causing that? So if you're losing less than 30 mils of blood, that means that period is probably kind of like spotting, and there isn't a day of shedding the uterine lining because there isn't much lining to shed. Or if there is a lot of brown blood spotting beforehand or afterhand, that's usually a sign of an infection. And so we want to keep an eye on those things. And that's why it's important to learn how to track your cycle and understand what your cycle is telling you. On the flip side, if you're losing more than 60 and that kind of 80 to 100 mils, and I mean, I've worked with women who lose 200 mils over their period and over 200 mils, that they're bleeding a lot. So there's a lot of shedding that's going on, but the question is, what's driving that?
Yeah.
And typically it's a hormonal imbalance. So typically you get a diagnosis of fibroids or endometriosis or PCOS, and PCOS can, do both things, heavy or non-existent periods. And basically then you dig even deeper and say, okay, why? Well, why do I have these things? Why do I have this hormonal imbalance? And right now, what we're seeing and what I'm seeing through lab testing, it's a pathogen, it's some sort of toxin that's driving the body to do things out of norm.
Mm-hmm.
And they're depleting nutrients. So then you're coming into, I have low B12, I have low iron, I have low whatever, vitamin C, or I'm constantly sick. And so there's like all these symptoms that start to point in the direction. So you got to remove the pathogen, you got to remove the toxin, and then you have to replenish the system. So then it can do what it's designed to do, right? And really it's you being, I don't want to say symptom free, but you being as symptom free and as comfortable as you can in your system. Like you should love your period because it tells you so many things, as opposed to dreading it, hating it, blocking it, and just having like an icky relationship with it, if you will.
So kind of a little bit off topic. I was on Instagram and one of these like stories came up and someone had sent it to me and I was watching it about tampons and how women aren't really supposed to be wearing tampons and we're supposed to just let the blood flow through and how it's bad for us. What are your thoughts on that?
Yeah, there is a sweet balance between like convenience and, what's good and bad for us. Now, a regular tampon, if it's full of chemicals and toxins and like, which most of them are, then you're putting it into your vagina, which is super sensitive tissue. There's a lot of absorption that happens through that. And so like women will get irritation right through their period. And especially if you've gotten away from wearing tampons, there's a lot of women who is like, I can't do it anymore because they realize the difference. So my thoughts on it is if you are going to use tampons, use something that's organic and use something that has nothing in it, because your tissue in the vagina is so sensitive. You don't want to be putting, like, you just want to be putting crap up there.
Yeah.
And that microbiome, in the reproductive microbiome, there's a lot of research on the importance of having a really good balance in your flora in the reproductive system that will not only help you get pregnant easier, but like the development of the baby, and then help you to carry to term. And I'm not talking just the miscarriage, but even like we're seeing an uptake in premature labor.
Mm-hmm.
And usually there's a microbiome imbalance. There's a bacteria, there's something that causes that labor to kick in. And, sometimes it's as simple as giving somebody antibiotics to stop the labor. And sometimes it's, you have to get the baby out, but it's coming down to like the bacteria not balancing. So if you have to use it, yeah, go for it, but make sure you're using something that is organic. If you don't love pads, I'm a big fan of the cups, like the Diva cups, the Nixit, all those things, because not only is it environmentally friendly, that decreases so much waste, but you then actually know how much you're bleeding and you can see the quality of that blood. So typically women will say, oh, I don't have clots when they have a tampon, because it kind of absorbs it and you can't really tell. Versus if it's a cup and you're pouring it out, you can see if it's a good quality, like what color is the blood? Do you have mucus? Do you have strings? Do you have clots in there? Because that again is like your report card.
What does a clot mean?
A clot is generally, it's a stagnation, right? There's no blood flow. And so it's the stagnation could be that you don't have enough blood flow in the uterus. You don't have blood flow, like your liver is really struggling and congested because all the blood goes through the liver. And so when we have a lot of clotting, it's stagnation is kind of the easiest thing that I can say. Like there's no stagnation, there's a blockage, right? So there's a blockage, it forms a clot, and then it tries to smooth it out. And typically with clots, what do? You get a lot of cramping, you get a lot of pain, discomfort. And don't get me wrong, some clotting is okay, like pea size, a couple here and there, because you're not going to have a perfect blood flow. But when you're getting big, like toonie, loony, quarter size, and all the time, and you have a lot of pain and discomfort, that's a big sign.
Yeah.
Yeah, that's a sign. You should never be so uncomfortable that you cannot go about your day. Like on your menstrual cycle, you'll feel a little bit more tired. You'll feel a little bit withdrawn because you are, you're bleeding, and there's energetically, you're in a more like downward phase. Those are all okay. But if you have to be at home with a heat pack and, Tylenol, Advil, whatever, otherwise you can't go to work once a month, like that's not normal, right? Or throwing out because you have so much pain, or you have to pop a bunch of pills or do all these things. It's like not normal, and absolutely a sign that you might struggle with your fertility, right? And so we want to be mindful of those signs earlier on. Before you even
got to be educated on our blood flow, Hey friends, I hope you are enjoying this week's episode of Not Your Mama's podcast. This podcast would not be possible if it wasn't for the support of you, my wonderful community. To support Your Mama's podcast, please click the support link right down below, and you can donate just as little as 99 cents. Also, follow me in the Shop Like to Know It app, where you can follow me with all my exclusive content, all the way from baby products I love, fashion and style, and everything in between. Now let's get back to the episode. And I think we do, as women, we don't think about it. We're like, oh, this is just how it's supposed to be. Painful, we bleed, all that.
Especially if your mom struggled with the same things, right? It's because you grew up with that. When do you start to realize that it's not normal is when you start talking to your female friends. But then you just have that friend, you're like, oh, they just got lucky. And it's like, it's not, and everyone's going to get impacted in a different way. So some women will have terrible cycles, where some women will have terrible digestion and terrible skin, and some women will have all of it. It's like, we're all different. So you can't compare yourself to somebody else, but there is the norm, right? And I'm doing quotations because like there is a window, and it's okay to have some variance within that. Like maybe some days your cycle is 28 days and the next it's 29 or 32. that's okay. 3 to 5 days variance is not a big deal.
Mm-hmm.
10 to 20 days is a huge deal,
Yeah.
and uh, you bleed for 3 days versus 5 days, not a big deal. But like you're not bleeding versus 10 days, huge deal. And those are kind of those red flags, like okay to be in the norm, like okay to have some discomfort and be a bit more tired, especially if you push yourself hard that month or whatever. But to not be able to function through your cycle, not normal.
Yeah. Um, Before we dive into your program, I wanted to say like the non-organic tampons have graphene oxide in them, which is cancerous. So if anyone doesn't know that, like
Yeah.
beware of Playtex and Tampax and stuff because they have graphene oxide in them. And so please go organic because
Yep. It
that, like
makes a
you
really big
said,
difference.
it absorbs your uterus. It's literally sitting inside of your body and like absorbing all of that toxic stuff. It's very unfortunate that here in America, we give people products that give them cancer, Alzheimer's, so many horrendous diseases, but that's just the kind of system they want.
Yes. Well, we have to, I mean, you always follow the money. And if it's the pharmaceutical industry that's running it, running the world, then they're going to profit from people being sick.
Just like the
Right.
opioid crisis, they knew it
Yeah,
was addictive and they
of
still pushed
course.
it and made billions of dollars off the expense of
Sure.
the American people and their health and the families' lives and stuff. So, I
Yeah.
mean, yeah.
That's a whole other podcast.
Yeah, that's a
And
whole
it is,
other podcast I
but
could talk
but
about.
the truth is, like, what my goal is to get loud about some of these things and talk about it and empower people. Because like I said, if you feel in control of your health and if you feel confident in your body, like truly confident, when I ask my patients, like on a scale of 1 to 10, how confident do you feel? 0 being you want to hide under the blanket all the time, and 10, you're like in a bikini making a speech. Because people are like, no, I feel pretty confident. I'm like, in a bikini making a speech. They're like, oh, no, not that confident. It's like, okay, so we're not really confident then, right? Because you want to feel super comfortable in your body and you want to understand. And like, it doesn't have to be perfect. It just has to be what you feel good in, right?
Mhm.
Like, the way that I feel in a bikini now is different than when I was in my 20s before I had kids. But I actually feel way more confident in my bikini now than I did before.
Oh,
And that's
I'm
just
an opposite. I'm
growth
like, I
and
gotta do
mental.
a one piece.
Yeah. But it's like, it doesn't matter, right? Like the goal is like, do you feel comfortable doing that? Or are you picking yourself apart? Or are you uncomfortable in your body because you feel like you're doing all of these things and it's not commuting? Like the most common frustration with fertility, but before I was in fertility, I was in this kind of IBS and weight loss space because that was my story, is I was putting all these hours at the gym and all these things trying to lose weight and nothing was happening. And so it's the most frustrating and disappointing and hopeless, powerless feeling.
Yeah.
And that's the same with fertility. When you're putting all this effort in and nothing happens, you're like, why would I keep going? And the truth is, a lot of the times you're putting effort into the wrong things. And so working with a professional is going to help you understand where to put your energy so you see the result paying off. That's truly like what I believe that has been the journey for me, whether it's to relationships, for business, for my own health. It's having somebody say, this is the wrong place to put effort in, put it here. And as soon as I did that, magical things happened, and it was like, oh, okay, this is what I need to do. So if you feel like you're spinning your wheels and you've tried everything, just know that you have blind spots and you can't see them yourself. And if you have somebody that shows you what they are, you can put that same effort and even less and then experience the results.
Yeah. No, that's great advice. So tell us a little bit about your Fertility 101 program.
Yeah, so Fertility 101 is really designed for anybody who's looking to get pregnant in the next 3 to 12 months. It's a program designed to help you and your partner get ready to put your best foot forward to create your future baby. And I cover things like, and here's the thing that I think most people don't realize is when they're ready to have kids, they're like, okay, let's start trying now. where the things that you're doing today is impacting the quality of your egg and the quality of the sperm 3 months from now. So males make sperm every day. Their life cycle is about 72 days. So let's call it 2 to 3 months. For females, we're born with all of our eggs, but the maturation process, so to mature your egg, takes about 3 months. So the things that you're eating, the things that you're drinking, the things that you're doing in terms of activity and work and stress levels are all impacting what your egg is going to be like 3 months from now. So the minimum amount of time you want to give yourself is 3 months. Now, if you have health issues, if you have been on birth control for a long time, I call it like a filtration system. If the water is really muddy and you just filter it once, it's going to be better than the other, but you might need a couple more filtrations, right? So we need another 3 months time to give your body a chance to make a better sperm, to mature that egg and prepare that DNA, right? That DNA that's going to replicate. So the program covers nutrition, it covers the perfect environment, how stress management, sleep, how to basically prepare your system, what labs you should run to do a checkup to see what your fertility journey is going to look like for both you and your partner, and what supplements you can start to take in order to, again, optimize your chances. And then, of course, I talk about like, hey, when should you reach out for help if you started to try, as opposed to, you're on your own now, and because it's a really big change. So let's not wing it. We put more energy and effort into buying a home than we do into building a family. And like, I'd love for that to switch, right? I'd love for that to switch, because your baby doesn't care where you live. The first place that the baby is going to live is your womb, which means it's you. So you should put as much energy as you can into you to be the best kind of vessel to grow that baby, instead of the baby room, right? Like the baby doesn't care about that.
Well, the baby, I noticed too, sorry, I didn't mean to interrupt you, but you're so right about that. Like, we get all this shit and I barely used any of it. My kid still doesn't even sleep in his own room.
For
Like,
sure.
we have the crib, they sleep with us, like next to us.
Yep.
When they're little, they're too young to be by themselves. And I don't believe in like the cry out sleep training. I believe in do what's best for you and your family. And if that's like your kid sleeping with you, then that's it. You don't have to agree with me or not, but that's just what works for my family.
Absolutely.
And my sanity, and it's not going to be forever, or you're never going to get that moment back. You're never going to have your kids be little anymore. So savor it. I feel like as like the society of America, it's like they have to be independent right away. They have to go sleep on their own right away. Like push them out to be like little adults. Like, no, they need to be little babies and love them up as much as you can. Snuggle the shit out of them. Give them the kisses that they deserve and need and you want to give. I mean, yeah,
but to your point, it's, we spend so much money on the crib and the room and the environment, but what I would love for you to spend your money on is like the lab testing and the supplements, and like spend money on good supplements because they work. Spend money on some testing and a practitioner that's going to help you to figure out how your body works. So then you're like, oh, but it's so important for me, for this baby to have, right? And I get it, because I did the same thing. I want to make sure that she had the perfect room, and it's like, she doesn't care.
She has no idea. She's just gonna look at the pictures.
Exactly. And so if I can switch that, because then why are we seeing so many people sick, right? It's like, well, because we're spending money on the wrong things.
Yeah, well, we're a consumer
money and energy. Yeah, that's it.
Yeah. Well, and like also people want to like flex, like, oh, look how great my design skills are, and like look at my expensive crib, and look at all this flashy
it's a little
stuff I have for
competition,
my
right?
baby that he's not going to use for probably a year and a half, 2 years,
Yeah.
So the best advice I ever received was from one of my friends, and she was on the podcast talking about postpartum, and I was pregnant when I met her, and she's like, all you really need is like a basket and put the baby in. You can just carry the
Even
baby.
a cardboard box will do.
Yeah, and she was so right. I'm like, yeah, you really don't need all that stuff. You just
Mhm.
need a
For
nice
sure.
little bed next to them, some clothes, diapers,
That's it.
formula, or your tit, whatever you choose to
Yep.
do,
Yep.
and love.
That's it. Keep it simple.
Yeah, yeah. I'm a simple, easygoing kind of girl. I'm just like, everyone's like, what's the schedule? I'm like, I don't know. Like he goes to sleep
Oh, yeah.
between 9:30, 10, whenever he wants to. Like
Yeah.
feed him when he wakes up. Like it's just a loose schedule.
Yes. Yeah. Yeah. Well, I mean, it's intuitive a lot too, right? No one knows your baby more than you. No one knows your baby. And I mean, it goes back to like, nobody knows your body more than you.
Yeah.
So, like and I know if there's women who are listening to this who have struggled in fertility, I know that that something is off and you just have not been able to get the answers. And then you start to create this belief about yourself. Like, I've had women say, well, I just think that's what's meant for me. That's what God. And I'm like, you think God has time for that? He pointed at you and said, no, you can't have kids. That's
Right.
crazy.
Yeah.
7 something, almost 8 billion people in the world, and he picked you. I don't think so. But that belief is really deep driven now. And it's really hard to break that. It's hard to break through. And the body is incredible. It has an amazing ability to heal. And if you can find a way to trust it and find a way to heal it, then you can pass that on to your child. Because if you don't know what's going on in your system, guess what happens when your little guy or girl is sick? You're going to freak out and you're going to have to go to the doctor and figure it. And you'll know something is wrong, but that doctor is going to say, no, it's fine. It's normal for them to have ear infections. It's normal for them to have eczema. It's normal for them to have tantrums. And don't get me wrong, some of those things are, norm. There is a little, but not the rates that we're seeing at now. And so
Yeah.
it irks me when we're normalizing disease in kids. And it's like, what are you talking about? I don't remember being sick like that. I don't remember having to take antibiotics. And I have, family members and patients that I saw that it was like, it's not normal. Stop normalizing it. But because you don't know what your system works like, you don't have a good relation, you can't pass that on to your children. And that's
Exactly.
really like why I got into naturopathic medicine and prevention. And like, what's an ultimate way to prevent disease before before you're even born?
Yeah.
So like, that's the great, like what you do 3 months or 6 months before you get pregnant will dictate your child's future life. And I know it's so hard to think about that and to wrap your brain around it. But if you have this health that you and your partner, quote unquote, figure out and you put your best foot forward, just think about what that child is capable of versus when you're sick, when you're tired, when you're overwhelmed. It's how do we expect to make happy and healthy babies out of that state? Right?
Yeah.
Like you just can't. And I know when I don't know how much it makes sense, but like when I talk to people, they're like, oh my God, it makes so much sense. And that's why IVF sometimes, don't get me wrong, sometimes we need it. But you want to come into a state feeling in control versus this doctor is just telling me what it's going to do. And I have no idea what's going to happen. Because again, we can do some testing and we can see if that's even going to work for you instead of wasting money on a procedure that potentially might actually be detrimental for you.
Totally. Totally agree.
Mm-hmm.
Well, Dr. Jane, I have 4 questions that I ask all
Mm-hmm.
my first time guests, and I'd love to know your answers.
That's
So,
easy.
my first question to you is who and what inspires you?
You know, my patients really inspire me. And I'm like, can I pick one specific one? Usually not, but it's the people who just don't give up. And those are the people that, hopefully they're listening as well, but that they're just fighters. They're courageous and they're fighters, and they fight in the right way, if you mean. So they're not burning themselves out, but they refuse to give in to the script and say, I can't have kids, I can't do this, it's not for me. They're like, I'm going to find another opinion. And that really inspires me. And it inspires me to do my work. And it inspires me to get on stages like yours to continue to spread the message, because, you know, it's powerful what the body can do and how they heal when you have some of these pieces figured out.
Agreed. Second question is, what is something you wished you knew when you were younger?
I mean, so many things, but honestly, that like life is trial and error. So make the errors now. Like just keep making them, and that's it. That's just part of it. Don't be afraid to make those mistakes, because you have to make the mistake to learn from it. And when I was younger, I just like really shied away from, oh, I'm failed at this, so I guess I'm not meant to do this.
Mhm.
It's like, you know, I was on a podcast or another interview where he applied like 40 times to this program before he got in. Like 40 times. Most people apply 2 times, maybe 3, and would give up.
Yeah.
So if you feel like it's something that's important, you have to keep going, because it's important to you. It just might take some time to figure out, and that's okay.
Yeah. No, I agree with that. I know in my younger years, I was definitely like, oh, I failed, gotta give up. Not for
Yep.
me.
Not for me. Yeah, that's it. Must be not meant to
What's my
be. And
path?
yeah, that's it. But then you figure out that every path has its challenges. And then, you know, when I went to naturopathic school, I failed my first board exam like 4 times. And there were so many lessons for me in there, but I knew the lesson wasn't to give up.
Yeah.
It was like, I'm missing something. And I had to do a lot of, you know, healing and just work to figure out what that was missing for me. But I never in my mind was like, oh, I guess it's not for me. Whereas even earlier, I would have said, oh, I guess it's not for me. It's just,
Mhm.
you know, not the case at all.
We learn as we get older, you
Hmm.
know.
You should anyways. You should.
Yeah. Some people stay, you know,
Yeah,
and
some
they're,
people stay, they do, but
but most
we
people
gotta
grow.
learn. Yes.
Okay. So my third question to you is, what's the essential part of your daily routine?
I think the essential part is, and I don't know if that could be, but like I have an aura ring that tracks like my sleep, and I just love that. Like I always check it, and that's my like measurement of how I'm doing and what I should do for the day. Don't get me wrong, sometimes I'm like, I'm tired today, even if my aura ring told me I slept well. But I love using that as a guide to help me map out my day. Like, okay, I had a good sleep. My readiness is good. I'm gonna do all this other stuff. Or like I need to get this movement in today. Um, so I don't know if I can use that, but that's the first thing that came to mind to me.
Perfect. No, usually the first thing that comes to your mind is the answer.
That's right.
I've interviewed a lot of people, and that's what I've concluded.
Yes, yeah. No, I agree. You have to just go with the flow.
Um, the best advice you've ever received.
Yeah, that's another really good one, and really hard, but I think it's trusting your intuition, trusting your own body. Because when I was going through my journey, I had a lot of distrust in it. I didn't, you know, I thought that it was against me, and learning that it really never is, and that it's just talking to you. And when it's in distress, that there is something going on, and you need to do some healing, and you need to do some work as opposed to ignoring it. So that has been a really big, not only like piece of advice, but a lesson that changed the way that, you know, I am today.
No, that's great. Well, Dr. Jane, thank you so much for coming on. This was such a fruitful conversation. If you want to get in touch with her, I have all of her links down below in the show notes. Don't be shy. Say hi. Do you have any last words before we say goodbye today?
Just to, you know, give your body some time to, whether it's to heal because you've been trying for a long time, if you had miscarriages, so give your body time to heal. And if you're getting ready to start trying, give yourself time to prepare, because it's a really big thing that you are doing, and we need to take it more seriously than I'm ready to start trying, so let's do it. It's like you spend so many years saving for a house and making sure that your career is right. If we just put an ounce of that effort into making sure that your body is at its best possible health, you would we will have really healthy babies and a really healthy generation, and we can wipe out a lot of disease. And so I think it's really, really important, and we should put more value on it.
Perfect. I love that. All right, guys. Well, thanks for listening to this week's episode of Not Your Mama's podcast, and I hope to see you in the next one. Bye.
Thank you for listening to this week's episode of Not Your Mama's podcast. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. We really appreciate it, and we'll see you in the next one.